This video will describe why symptoms can sometimes take longer to subside and how to manage any lingering symptoms or difficulty getting back to full sport and school. There are several factors that may contribute to why some people have symptoms for a longer period of time than others. Probably the most likely and logical factors are related to the symptoms that the person may have at the time they sustain the concussion. If symptoms come on right away, are pretty strong, and the person has a lot of different symptoms, such as headache, plus nausea, plus confusion, plus dizziness, etc., the more likely they may be to have longer lasting symptoms. Women or anyone with a history of migraines tend to have symptoms that last longer. This is thought to be related to fluctuating hormone levels and their impact on recovery. Normal recovery time for kids and adolescents is also closer to 2 to 4 weeks, compared to 7 to 10 days for an adult. And since we are in between those categories, it might make sense that symptoms may take a little longer to subside. Finally, people with a history of a learning disability, ADHD, depression or anxiety disorders, may sometimes take longer to recover. The key to knowing your risk factors is to understand that if your symptoms don't seem to go away as quickly as someone else did, it may still be a normal recovery period for you. As stated in the previous video, there are a lot of things that a player can do to help facilitate a faster recovery. Things like immediate removal from play, getting enough sleep, and making sure to hydrate and eat are big components. When a player returns to play after a concussive event, there is an added energy demand, which can slow down the recovery process. The healing process requires a lot of energy, so the brain requires an increase in nutrients and rest as well. Another type of avoidable energy demand is excessive cognitive load, such as taking an exam or trying to study for a test within the first 24 to 48 hours after sustaining a concussion. One final response to concussion that can prolong recovery times is called strict rest. It was thought at one point in time that anyone who sustained a concussion had to do nothing and basically sit in a quiet room until all symptoms have gone away. In the recent years, this has actually been shown to be significantly less effective compared to relative rest and a graded return to activity, such as described in the previous video. A gradual reintroduction to activities within the first 1 to 4 days post-injury is most beneficial for the brain to heal. Typically, if well managed, concussions can completely resolve in days to weeks. However, if there are risk factors for prolonged recovery, these symptoms may last longer, so involving a healthcare professional who is specialized in concussion early can be important in the recovery process.